In this next slide, we see the endpoints of the two solo trials, and I was an investigator in one of these trials. These were 16-week studies, randomized controlled trials, which compared placebo injections weekly with either Dupilumab 300 milligrams every other week or Dupilumab 300 milligrams weekly. The primary endpoint was achieving clear or almost clear. And this is a meaningful endpoint for both patients and for physicians. Achieving clear or almost clear, we can define as success. You can see both in Solo 1 and Solo 2 trials on the left graph that only 8 or 10% of the placebo patients achieved control that is meaningful, that is clear or almost clear. By contrast, both weekly and every other weekly Dupilumab in 35 to nearly 40% of patients achieved clear or almost clear, the primary endpoint. In terms of the secondary endpoint, achieving EASI-75, that is a 75% reduction in the eczema area severity index. In the Solo 2 on the right, we see a 12% reduction in EASI-75 in placebo. In one trial, 15% in placebo in the other, whereas essentially half of all of the participants receiving Dupilumab weekly or every other weekly achieved EASI-75. In the next slide, we see long-term results from the Liberty AD CHRONOS series of studies. These are 52-week results. And on the left, we see again the percent achieving clear or almost clear with a greater than 2-point reduction from baseline. In the placebo group, we see only 13% achieved clear or almost clear, whereas 36 to 40% of the patients receiving weekly or every other weekly Dupilumab achieved it. The next series of columns are those that achieved EASI-75, 75% reduction in the EASI score, roughly 65% versus 22%. Then on to other outcomes. Reduction in body surface area from baseline, roughly 40% in the two Dupilumab groups versus 20% in placebo, and those experiencing on the far right a meaningful reduction in itch severity. That is a 4-point improvement on a 0 to 10 scale. So 39% with the weekly dosing of Dupilumab achieved meaningful itch reduction. 51% achieved it in the every other week Dupilumab study, whereas only 13% in the placebo group achieved this. Please note that in the United States, the approved dose of Dupilumab is initially a loading dose of 600 milligrams, followed by 300 milligrams every other week.